Hi, and welcome to Tharaka Foundation's YouTube channel, Supporting the Whole Child. We just wanted to give you a quick disclaimer saying that everything that is found on our YouTube channel is created for informational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition, and never disregard professional medical advice or delay in seeking it because of something that you have heard or seen on this YouTube channel. Thank you so much, and without further ado, let's begin today's video.
Hello everyone, welcome to the Tharika Foundation YouTube channel Supporting the Whole Child. I'm your host Poonam. I do have Dr. Leena Khanzode with me. If you remember, we have been talking about anxiety disorders in our past few episodes. So today, Dr. Leena, what are you going to educate us about?
So thank you, Poonam, for having me again. So far we have covered three different types of anxiety disorders. We talked about generalized anxiety disorder, then we talked about separation anxiety disorder, and in our most recent episode, we covered social anxiety disorder. So today I'm going to talk about the fourth commonly seen anxiety disorder called panic disorder. So what panic disorder is as we, in our very first episode, when we were talking about the difference between what is anxiety, what's an anxiety attack, and what's a panic attack, if I can take you back to that episode, we had learned about the fight-flight system and how that attributes to having physical symptoms of anxiety, and panic attack is nothing but a manifestation of that physical anxiety when the anxiety is too high. So what panic disorder entails is that when people start having recurrent panic attacks and they are happening out of the blue, so often there could be triggers that, something stressful triggered the panic attack. But sometimes, as these progress, people may get them untriggered, like it's out of blue. You have this surge of anxiety that you notice in your body physically, and you may have symptoms of different kinds. So I'll list a few. It could range from having some dizziness, if you're going top to bottom, some dizziness to having trouble breathing, feeling really short of breath, to tightness in chest and chest pain sometimes, to having heartbeat fast, so it's like palpitation. If you go down, you can feel queasy or nauseous in your tummy. Often, because of that fight-flight mechanism, our muscles are contracting too hard, so people notice a lot of muscle tension or tightness in their body, and often it can be manifested as shaking. Now the muscles are contracting way too much. It can present with sweating. Sometimes people feel as if, they are going to have a heart attack kind of feeling. There is this extreme feeling of loss of control over your body, feeling like something is out of sync and balance. And we use the term feeling of an impending doom. That's kind of the feeling person may get. And so not everybody has all the symptoms I described, but majority of those symptoms are present. And if your panic attacks are happening recurrently, ranging from few seconds to few minutes, and sometimes even lasting for after effects for hours, then, you start developing this fear of panic attacks happening anywhere you go. So as a result, people start avoiding going to places because they feel more secure and safe in their particular place, maybe their home or with their near and dear ones. And they feel like, what if I have a panic attack in the store, if I go to in the mall, or if I go to visit a friend, then who's going to help me? Usually that feeling of impending doom is so scary and so worrisome that people feel like they are trapped and there is no escape from that feeling and nothing is going to help them. And so often, avoidance sinks in. And then a lot of the times along with avoidance, this particular fear of going to different places because what if I get a panic attack there and I won't get help or I won't be able to escape? What we call as agoraphobia develops. So then, often people come to us with this in this stage where they now have developed what we call as panic disorder with agoraphobia. And then, quite a few times, people do recognize it earlier and come in earlier into treatment without developing that last stage of agoraphobia where you're like avoiding going to places. So that's a pretty debilitating type of anxiety disorder, honestly, because those physical symptoms are so uncomfortable, just distressing, that people usually are in a lot of pain. And that's one of the disorders that brings people to mental health professionals sooner than later.
Thank you, Dr. Leena, for sharing and educating us about it. So in general, what I understand, so the life is kind of impacted, the quality of life, right? Like person is not really enjoying, and day-to-day activities sometimes are rather getting impacted. As you said, they are not ready to go out and they are maybe not meeting with people. So as you said, some people do come at the late stage, but I'm sure our intention is to all those who are listening to us to educate themselves and prevent, not go in that disorder mode, right? As you said, panic attack and panic disorders. So attack may happen. And as you said, physical symptoms are very obvious. Nobody can miss it. So we are trying here to educate our audience not to go to that disorder stage. Rather, if it happens to you, do see that mental health provider and see a doctor. So any other things, Dr. Leena, a patient can do to prevent? And if not prevent, as you said, they should see a doctor. And what happens once they see a doctor?
Let me talk a little bit about the prevention and a little bit of the treatment part subsequently. So the understanding we have in general about panic disorder is that it's one of the problems related to, of course, underlying anxiety. And what we understand is that usually there is enough anxiety brewing underneath for a while before somebody gets to a panic attack or panic disorder stage, particularly panic disorder stage. I think panic attacks can happen with certain triggers. For kids, it can happen during tests or certain performances. So that's normal physiological kind of way of our body saying, I'm too stressed by this stimulus. But for somebody to have recurrent episodes of panic attacks, we understand that, there was something already kind of happening over the last few weeks to months, rather, in terms of anxiety building, whether it was particular anxiety about a stressful situation they've been in for a while, or they have generalized anxiety kind of temperament, and that worrying kind of about different things has now led to this new kind of disorder of panic disorder. So what we see is that when you have one type of anxiety, so let's say I may have predisposition for generalized anxiety. So if I have an anxious temperament, I tend to overthink, over worry, over analyze. I am likely to develop generalized anxiety disorder if I don't catch it there in a way, right? So being aware of your thoughts and using techniques to really refute your worries like we've talked about before. But what we understand is that when I have one particular type of anxiety, I'm likely to get anxiety of other types. So that's very commonly seen. So if I have generalized anxiety tendency, I am more prone to develop social anxiety, panic attacks or panic disorder, separation anxiety, things like that. So even though these are separate kinds, I think because their pathophysiology is in the same system, the limbic system, our emotional brain, we understand that there's a trickling effect, and people may have symptoms, in different categories. But when somebody is developing recurrent panic attacks, it's telling me that there was probably some generalized anxiety or some kind of traumatic experience that triggered this panic for them, and now they are sensitized by that, and every little thing that's reminding them of that trauma or how it was stressful during that time, that can trigger panic. So it's like once your system is sensitized, you're like likely to have more episodes, rather quickly. So the prevention is to, again, recognize if I have general anxious temperament and work on, taking time to work on your thoughts, and your mind needs that rest and break, practicing meditation, mindfulness, exercising, sleeping well, eating right nutritious food, kind of the stuff we talked about earlier in the episode. So that is one big way of preventing. And then, of course, we try our best to prevent, but if we have hereditary predisposition for this problem in our family, or we are experiencing a lot of stress in our life, these things still do come out. But then we can recognize them early and get them treated early. In terms of treatment, the same therapy that I talked to you guys about last time, cognitive behavioral therapy, is known to be hugely successful also for panic disorder. The focus, we tailor it a little bit differently for each disorder. Like I said, for social anxiety, the focus is more on exposure and gradual desensitization. In panic disorder, on the other hand, there's a lot of focus on educating and understanding why panic happens, like the whole flight-fight mechanism, really understanding that it is just a body's way of reacting to feeling stressed, and it's not like truly your body's going through some major physical problem. Like people do think that, am I actually going to have a heart attack someday? Am I, so there is a lot of this fear that, am I, having truly some damage to my physical organs when I'm feeling this, because that feeling is extremely uncomfortable. So it seems very real in that situation. So really taking the power away from the anxiety to stop scaring you more is the main focus of the education that we do in panic disorder patients. So basically we talk about that this is just body's physiological way of responding to stress, and nothing serious or critical is happening. And we make them understand that it's a vicious cycle. So we talk about this concept of getting anxious about being anxious can really reinforce this mechanism of more panic. So for instance, because you're not feeling comfortable in your skin and you start feeling these weird physical symptoms, you're naturally drawn to that, and your attention goes, and you're like, oh, I don't feel right. What's wrong? What's happening? What's going on? When will this stop? Does it mean that I'm going to die? Those types of thoughts come in. And that's what we mean by getting anxious about being anxious. So in panic disorder, this is a very important feedback loop that feeds into more panic. So like we talked about, the CBT construct of the way I think affects the way I feel, and the way I feel affects the way I behave. So to begin with, if I am worried about something like, what if my meeting with my teacher doesn't go well? And I'm worried about, that. And so I'm already feeling a little bit of that flutter in my stomach and feeling a little nervousness. And in the actual meeting, if I start feeling those physical symptoms, I start feeling like, oh my gosh, what's happening? What if I lose my ability to control myself? What if I don't talk right? What if I'm not making sense? What if my teacher is able to see how am I feeling right now? So that is another thing to remember, that whatever you're experiencing is not visible to others. I mean, they may be noticing you are tight and you may be sweating, maybe you're, maybe shaking, and, and so people do see that that's nervousness. And so it's not that, they are feeling the same level of distress as you are. You are, at that time, the anxiety is putting this magnified lens on your eyes and making it feel like it's really bad, and everybody else can see how bad it is. So naturally you are feeling more embarrassed and you're feeling like, oh my gosh, I'm losing control. And so what happens is the more I think that way, the more my anxiety is being fed into. So I think more like this, my feelings and my anxiety goes on that thermometer from now, even from 5 to 7, 7 to 10. And then it reacts by that same physiological response of fight or flight. Because every time my emotional brain is getting a signal, threat, danger, something is off, something is wrong, what's wrong with me right now, it's responding the same way. It doesn't differentiate if it's a real threat or just a perceived threat, like I talked about before. And so it's releasing more stress hormones, it's releasing more of this panic response. So it's really important to break that loop of getting anxious about being anxious. And once you understand that it's a wave, if I stop worrying about why this is happening and take, charge of like calming down by deep breathing or reassuring myself this will pass. It's like I'm riding we kind of give an analogy of how you surf a wave, for people who surf in the ocean, you can surf this wave, you can just hang in there. You don't need to do anything but just be with that moment, breathe, and let it pass. And so that's how you can actually break it and you can prevent that further acceleration of more and more panic. So that's a very big part of treatment in CBT we do for panic disorder.
That's really good to know, Dr. Lena. And what I understand, as you were saying, you do kind of do that root cause analysis with the patient. Maybe they are holding on to their past, they had some experience, and thinking about those past things, they're again feeling that anxious. And then maybe they're worried for their future. As you were saying, they need to maybe face some big audience or test or any other life situation. So even though it's happening or not, but they might be thinking about it and getting anxious. And when they are maybe in that situation and they are feeling anxious, there are some symptoms, but it's okay to have, right? As long as you are under control. And it was a wonderful way, as you explained, we need to break that cycle, that vicious cycle. And I think that's where your role comes in as a health professional. You do give them the tools and tips and enable them to break that loop, right? Sometimes we are not able to break ourselves and we do need help. And that's where I think it's very important for us to see a professional who has the tool and tips and experience to help such cases. That's really good to know. So other than prevention part, and as part of treatment, do you need to even recommend medicine sometimes?
Yes. So sometimes when people are in more severe stage of panic disorder, like I said, now it's progressed to the building agoraphobia and their life is kind of stuck now. They are like stuck at home or they're not able to function. Their life has become very limited. Then, we know CBT works, but it takes a bit of time. It needs a little bit of effort on the part of the client to constantly practice those skills. So it's like understanding is one, but implementing is a whole another ball game, right? So sometimes we know that over time, when this problem is being brewing for so long, and your chemical imbalance in the brain has now become so much more severe, we need to also look into medication and add that in complement with therapy. And the role of medication is really to help reset that chemical imbalance of the neurotransmitters like serotonin in our brain. And what it allows then is like when we are lowering the anxiety a tiny bit with the help of that chemical adjustment with the medicine, the person is now able to embrace and use the CBT skills much more effectively. So that becomes a very reason why we recommend medication in severe cases, in more moderate to severe kind of cases, actually. So the gains that you can get with therapy are like multiplied tenfold if you add the medicine. And it really empowers the patient to feel like, yeah, I have, not that I understand now, I can actually implement and see the results that if I stayed calm, if I practice my relaxation exercises, my breathing exercises, I can actually beat this panic disorder. So usually, people have questions about how long is the medication for, what does it do, does it cause any harm? Naturally, because when it comes to our brain, we are all worried. And when it comes to kids, particularly, parents are very worried about, do I want to medicate my child? It's something that will affect his brain and development. So, for viewers who are curious about that, the good news is that these are safe medications. They have been studied for years now. They have been approved by FDA here in US, the Food and Drug Administration, for use of these medications in even kids as young as 7-year-olds. Okay, so we have that level of safety data to help us treat even younger kids sometimes. They tend to be very effective, about 80% success rate. And in combination with cognitive behavioral therapy, we see a huge success. I mean, it almost takes you to that 90-100% range. The medications are generally given for about a year time. So it's not like, usually these medicines take time to kick in and start helping. So they take anywhere from minimum of 2 to 3 weeks to even start showing some benefits. And then by 6 to 8 weeks into the medication at the right dose, you can see a huge difference. So there is a lag in improvement, which is why adding therapy off the bat is important, because while the medicine is kicking in and while we are figuring out it's the right one for you, you are seeking support, getting education around what this problem is and how you can treat it and how you can get rid of it. The 1 year mark is from research studies. It's basically known to us now that if you try to stop taking it, let's say a lot of the times people feel better by 3 months into it and they feel like I'm cured and I'm better and I don't need it, I'm doing therapy. But what studies have shown that if you discontinue it any sooner than 1 year mark, roughly, you are likely to have relapse in symptoms, because it's like that's the time that much time is needed for the chemical imbalance in the brain to completely reset. So it's a commitment for about a year, and people feel worried about that. But again, studies have shown that there is no impact on your child's brain development or other development or growth. They are particularly safe in all age groups, including younger kids. Most of the times when somebody is doing CBT work really well along with the medication treatment, they are able to go off of the medication, and the CBT skills become their lifelong skills to manage the stress and anxiety longer term.
Okay, Dr. Leena, that was really good education for all of us. Yes, things can happen, events happen in life. We may have that anxiety, our kids may have it, but there are preventive actions, and then there is a medication. So it is very nice of you to talk to us, educate to us. So we would like to learn more from you in our future episode. Thank you so much for joining today.
Thank you.